You're watching the American Health Journal, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch the American Health Journal each week on this PBS station. And now back to Roger Cooper and the American Health Journal.
Some eye-related conditions are so serious they can lead to blindness. Dr. John Hovannessian of Harvard Eye Associates spoke to us about advanced technology that gives new hope to patients suffering from keratoconus and macular degeneration, two diseases that can rob patients of their sight and their independence.
Keratoconus is a disease where the front window of the eye, the cornea, gradually becomes weak, and it causes the shape of the cornea, instead of being a perfect round shape for focusing light, to become more and more and more like a cone, and that causes vision to become very, very blurry. Keratoconus can begin in childhood, or certainly young adulthood, but it can continue to progress throughout adulthood. Although most of the worsening happens up to about age 40, people even in their 50s and 60s with this problem can continue to have problems and have more and more trouble seeing or fitting contact lenses. We find out about keratoconus in people who've had multiple eye exams and often still aren't satisfied with their vision. And then special testing is done called corneal topography, and we measure also the thickness of the cornea with ultrasound, and that tells us that this problem is present. The treatment for keratoconus begins with glasses and contact lenses, but often as the disease progresses, the cornea becomes so irregular that simple contact lenses won't work. As the cornea becomes more and more steep in its curvature, a contact lens won't sit there, it'll fall off. And so we use rigid contact lenses that are designed to provide a more regular shape. As the condition continues to get worse, it becomes impossible even to wear contact lenses. When contact lenses become impossible in keratoconus, in the past the only treatment has been to resort to a corneal transplant. A corneal transplant, of course, is a procedure where we replace the tissue of the front window of the eye, of the cornea. It's a procedure that takes about an hour, but it takes about a year of healing afterwards. There are stitches that are put in the cornea, and those stitches cause irregularity, and they cause, in many cases, discomfort. And of course, there's forever the risk of the body rejecting that cornea, so that the procedure would have to be repeated. More recently, in the past 12 years in Europe, a procedure called collagen cross-linking has changed the equation, and it's given us something in the middle that can help patients who are otherwise failing with glasses or contact lenses. Collagen cross-linking is different from LASIK. In LASIK, we use a laser to remove tissue from the cornea to make the shape more desirable so that we can have better vision. In collagen cross-linking, we instead treat the cornea with ultraviolet light. And this has the effect of taking a weak cornea, which is of course the problem in keratoconus, and making it stronger. The effect of collagen cross-linking begins within just a month or so of treatment, but actually increases over time. Collagen cross-linking acts by causing the different layers of the cornea to attach to each other with cross members or cross links. Just like when we build a house, we build cross beams to make the structure stronger. This causes the cornea gradually to become stronger over time. That strengthening of the cornea also causes the steepness in the shape to flatten over time. So for 5 years or even more, we can continue to see an improvement in both the shape of the eye, but more importantly in the vision. Collagen cross-linking takes about an hour in the office, and a good part of the procedure is simply applying eye drops to the surface of the eye. Those drops soak into the eye and cause it to be numb, so there's no pain during the procedure, and they also sensitize the eye so that the ultraviolet light will have its effect to strengthen the cornea. The treatment with ultraviolet light lasts just about 30 minutes. It's painless, and afterwards people can go home and go on with their lives.
What about surgical treatments that may be needed after collagen cross-linking, like a corneal transplant or LASIK?
Collagen cross-linking is designed to prevent us from needing to do a corneal transplant. In some cases where it's unavoidable, a transplant can certainly be performed later. In the past, people with keratoconus have been told that there is no way they could have any form of laser correction. With collagen cross-linking, in some patients who are candidates, it is possible to do laser correction after cross-linking. The problem in keratoconus is that the cornea is too weak to allow a laser to remove tissue to improve vision. But with cross-linking, we strengthen the cornea, and that makes it possible for many people to have LASIK later on.
We'll be back with innovative lens implants for patients with macular degeneration.